This is Table 9's video, and our discussion topic is whether or not pharmacists should assume the role as the pharmacogenomics expert on an interprofessional team. And our position is affirmative that yes, pharmacists should assume the role of the pharmacogenomics expert on an interprofessional team. Pharmacists should assume this role because of their integral role as a healthcare provider and their extensive knowledge as drug experts. Pharmacists are able to provide consultation services, order testing in collaboration with the patient's physician, optimize drug therapy based on test results, and provide patient education and research. Pharmacists can also help to educate their fellow peers and the interprofessional team about pharmacogenomics and the role pharmacogenomics plays in optimizing drug therapy. Pharmacy schools have recently started to add more pharmacogenomics courses to their curriculum because of the anticipated future demands of using personalized medicine for individualized patient care. Since pharmacists are becoming more educated about pharmacogenomics, we should assume the responsibility of informing other healthcare providers as well as patients about the results of pharmacogenomic tests and the reasoning behind the adjustment of drug therapy due to the application of the results. Warfarin is an example of a drug where patients can benefit from pharmacogenomic testing. Warfarin has a narrow therapeutic window and shows substantial interpatient dose variability. Depending on the allelic variant a patient may carry, they may metabolize warfarin differently or be at an increased risk for toxicity. This means that warfarin doses should be adjusted accordingly to optimize drug therapy. A 2015 prospective cohort study was done in a group of patients on a psychiatric medication and was analyzed to determine if there was any medication cost savings associated if pharmacogenomics testing was done prior to the initiation. It was concluded that patients saved an average of $1,035.60 in total medication costs over 1 year compared to patients who did not receive prior pharmacogenomic testing. It was also found that patients that received pharmacogenomic testing showed increased adherence than compared to standard care. Not only does pharmacogenomics promote real cost savings, but also help to improve patient safety. This can be extremely important, especially in certain populations like those that do have to regularly take psychiatric medications, that they remain adherent to their medications. In conclusion, pharmacogenomics is a growing field, especially with a new and increased focus on personalized medicine. Pharmacists can play a crucial role as the pharmacogenomics expert on an interprofessional healthcare team and should be able to develop and modify drug regimens to cater to individual patients. With the pharmacist's growing scope of practice, pharmacists should be leveraged in order to maximize their clinical knowledge as the medication expert on an interprofessional team. Thank you.